All right, parents, I've had enough. Every day in practice, I take a case history of either an older child who's had too many rounds of antibiotics, either as an infant or as a young child, or we begin care with yet another infant whose nervous system, gut, their immune system development is an absolute mess because of antibiotics. For about 2 decades now, the research has been super clear that pediatricians have been overprescribing antibiotics for common things like ear and respiratory infections. And the short-term side effects aren't good, but the long-term side effects are even worse. This video right here is for moms and dads who don't want to give their kid yet another antibiotic. And it's for moms and dads who haven't yet given their child an antibiotic and want to keep it that way. They're looking for the natural solutions for ear and respiratory infections other than antibiotics and medications. In this video, we're going to talk about the long-term effects of antibiotics and also the real root causes of ear infections in kids. The first thing that we look to do is to empower and educate our parents in advocating for their child's health, especially when it comes to understanding how antibiotics aren't always necessary or effective when it comes to things like certain infections, especially viral infections and mild ear infections. Overuse or inappropriate use of antibiotics can lead to the development of antibiotic-resistant bacteria, which can be really hard or even impossible to treat and combat in the future. The main thing that antibiotics disrupt and really affect and wreck a child's long-term health are 1. Weakening and suppression of the immune system, 2. Disruption of the microbiome, 3. Disruption of neurotransmitters and that gut-brain connection that we've talked about before, and 4. Development of antibiotic-resistant bacteria. The real problem with using antibiotics for ear and respiratory infections is that they don't address the root cause, which really is poor plumbing, bad drainage, and an imbalance of the neuroimmune system. The original factors that trigger poor drainage and neuroimmune dysfunction are birth interventions and trauma, especially C-section, vacuum extraction, and forceps use. There's a lot of research on C-sections and respiratory and autoimmune challenges in kids later on in life, not only because it disrupts the microbiome, but also the upper cervical subluxation and physical tension that it causes that disrupts the vagus nerve, the autonomic nervous system, all of which play a critical role in immune function and inflammation, aka the chiropractic part. As neurologically focused pediatric chiropractors, our foremost priority is to get to the root cause of these common ear and respiratory infections and serve really as the first stop and a natural drug-free solution for families who don't want to resort to antibiotics. Be sure to head to our website, check out our full article on the side effects of antibiotics and also our article on natural remedies for ear infections. Thanks for watching and we'll see you on the next one.